I've had people come to me after setting up the foundation, talking about our situation, that, like I said, I haven't spoken about this with anybody in 20 years. And that's mothers and fathers. So it's obviously a difficult period for fathers as well, seeing their wife in that situation. And even for others with general mental health conditions, it's enabled others to open up to me about, I had depression. So it helps people open up and get things off their chests and sort of normalize the conversation.
This podcast is for education and information purposes only. It is not a substitute for professional medical advice. Welcome to the Motherhood Clinic, a podcast about caring for mothers after childbirth, led by clinical experience and real-life stories. If you're a new mum and ever asked yourself, is what I'm going through normal? Should I be worried? Or who should I ask for help? Then this podcast is for you. It's for anyone navigating those early weeks, months, or even years after having a baby. Each episode brings together voices from across the motherhood journey, from clinicians, experts, and mothers from all walks of life. We're here to help you feel more empowered in your unique motherhood journey. We believe in a better start to motherhood.
Hamish, we made it. Thank you so much for coming on the Motherhood Clinic podcast.
No problem.
So by way of a quick introduction for listening in, one of the pleasures I get to have as a podcast host is to meet some incredible people, of which you're one of them. To give you a quick introduction, you are the co-founder of Break Off Capital and also the PAM Foundation. And why we're talking today is around your work in the PAM Foundation, which focuses on perinatal and postpartum depression. And why that's important is so many of the mothers that we're speaking to with the Motherhood Clinic, this is a big area where there isn't as much conversation sometimes, and there isn't as much awareness and education as to what it is, how to deal with it, what are some of the elements that we go through. And so much of the work you're doing is to raise that awareness and education, and also, importantly, what to do about it as well. So we want to use this conversation to really shed light on all the work you're doing and what we want listeners to be aware of. And what I would call out as an important fact is these things are, you may have never experienced it before in your life, and all of a sudden it happens. And this is not to put any scaremongering out there, but it's more to say that this could happen to anybody. And I think that's a big thing that we want to talk about. And how do we do that in a better way? I'll hand it to you to give yourself a bit of an introduction, and before talking more about the PAM Foundation, and then I'll talk about what's the layout of this conversation for today.
Sure.
Sound good?
Okay. Yep. So my name is Hamish Magoffin. I'm the founder of the Pranaya and Arthur Magoffin Foundation. My late wife, Pranaya, gave birth to Arthur in 2021, middle of COVID, and unfortunately we lost both of them to postpartum depression after 6 months. And for me, setting up the foundation in their name, wanting to continue their legacy was something that I needed to do. And thinking about the experiences that we had has led to the way that we structured the foundation. And I've been someone who, as you just mentioned, like, you might not be familiar with this or anything that you've come across in the past, but it can happen to anybody. And Pranaya being someone that didn't have any previous mental health issues, very happy, easygoing person, but we still ended up in the situations. For me, setting up the foundation, a big aspect was providing the appropriate care. And so we lived in Thailand at the time, and despite seeking care, there's not the same support networks that there are here in the UK. But taking a step back, looking at improving awareness and education. So even though that we were familiar with what postpartum depression was and looking for that help, one thing led to another, and here we are. So in a lot of the work that we do is admittedly on the awareness and advocacy front is out in Thailand, but we're set up with the first pillar of awareness and education, the second pillar of care, and then the third pillar of research. And whilst a lot of the awareness and education is done out in Thailand, we are set up in the UK as a charity, and I've done various advocacy and awareness events here in the UK. And the first pillar is self-explanatory. Second is about improving care, be it screening, identification, treatment, and then the third being research. And that could be epidemiological, understanding more about it, what are the economic impacts, and also for me, something that's a big focus for me is looking at the physiological, so medical research, what are the causes, and that is a huge underfunded, under-resourced area. So in general, that's my background and how I set up.
Thanks. That's incredible. And also, we'll touch upon some of the incredible work you've done to raise awareness and some incredible feats that we'll touch upon in a moment, which has been fantastic. So yeah, I think that lays out, I think, the landscape for today. We'll follow those three pillars and walk through each of those, talking about what is the challenge and the problem of awareness and some of the elements like why is it not well known? What are some of the constructs that make it difficult to talk about both personally and as a carer? We'll talk about how do we address that with care, and then we'll walk through, I think, some of the insightful things you've learned along your journey in the research world to shed light on this area. So let's jump into that first bucket of awareness and education. And my first question would be, what are some of the main barriers that exist? Why is it still, in this day and age, such a difficult thing to talk about?
Yeah, right. Obviously, with anything mental health related, there are big stigmas attached. And so there's a lot of shame that typically comes with having a mental health condition.
Yeah.
And there's a lot of expectations around pregnancy and birth and how you should feel as well. That expectation that everything should be fine, you should be happy as a father or a mother, and then it's not, and it doesn't meet up to the typically sort of picture perfect social media standards that we live in today. That makes it harder to talk about it, makes it harder to share. But even prior to that, it was something that's prior to sort of the social media pressures, it was something that wasn't very much talked about, similar to miscarriages and that being a big taboo, but that's slowly being addressed. And I think the greater understanding of the physical side of miscarriages and how common they are helps to break that ice and bring that conversation out into the open. I think as the broader mental health conversation opens up, it becomes easier to talk about it. So looking at statistics of just postpartum depression or postnatal depression, first of all, being typically occurring in 1 in 6 new mothers, regardless of their socioeconomic background, regardless of their mental health history. On average, that's what it is. And to be clear, that's just postpartum depression. So if we pick apart those words, what is postpartum depression?
Yes, that's helpful.
A lot of people don't know the difference between postpartum or postnatal, but it means the same thing. And it obviously refers to post, i.e. after giving birth, and depression being depression only. But there are a host of other conditions that come with giving birth, and it could be prenatal depression, it could be postnatal anxiety, prenatal anxiety. Bearing in mind, as I said, 1 in 6 is postnatal depression specifically. If you look at the stats across prenatal anxiety, other conditions, obsessive compulsive disorder, post-traumatic stress syndrome, tocophobia or fear of giving birth, and all the other conditions that can come with that, the stats are obviously a lot higher. And then there's some confusion between baby blues and PPD. What is baby blues? How does it differ to PPD? And we can talk a bit about that. But baby blues being that short-term mental health difficulties, typically 1 to 2 weeks after giving birth, but then dissipates, and that occurs in about 70% of new moms. That in and of itself, you start to stack up those figures, it's very common, regardless of your background and how prepared you might be. I think having that conversation, bringing it out into the open, understanding, oh, actually, my friend had PPD I wasn't aware of, or my someone else in my family, or friend's wife, etc. And this doesn't even get into the father's aspect of paternal PPD, but on the mother's side, it's much more common. So I think for people to understand that, break the stigma, break the taboo, and open up that conversation and educate. But I think educate along the way, and as you said, it's not fear-mongering, it's just understanding, okay, these are pretty common. And in terms of, unfortunately, from our perspective, being one of the figures that does reflect is one of the biggest causes of maternal death. So yes, that is at one extreme, but then there is that spectrum. So understanding, okay, how can we address it? You don't need to be in a case where you need to see a psychiatrist and go under medication, but you can start with peer mentor support, speaking with those that have lived experience, speaking with group support, and looking for other resources.
Thanks, Hamish. I'll come back on a few points that you've mentioned there. You talked a lot about the different elements that might exist and the different conditions that might exist within that spectrum of depression. And I think, but the take home for me is actually, one, it will be helpful to identify or diagnose which one it is, but irrespective of whichever condition there may be on whatever spectrum from light to more severe, is just to have the conversation and to start that as early as possible.
Correct, yeah.
And your point about, we talked about this idea of fear mongering, but actually stepping into it and not, trying to ignore that, but actually understanding the nature of that, and that potentially the way you're feeling is potentially just a very big biochemical component because you're going through so much changes as a new mother, is to be aware of that and to have the conversation where it's no longer like something that you shouldn't talk about. By having the conversation and by having that openly, that's when we can start to address things and see things for what they actually are. Yeah. And that's the important thing. I do recognize there's also probably in some cultures or traditions that, again, mental health is more difficult to talk about. I would hope COVID was a turning point where, globally, mental health became a more visible topic to talk about. I don't know if that has helped people to do that, but there is still that stigma. I know that, my dad worked in psychiatry, and the biggest challenge is, if you had a broken arm, you could say, I need time off work, because there's a very visible challenge that you've got. It's a physical problem that you've got. No one would expect you to come to work and do stuff, but because we can see it. But the massive challenge that I can identify with is that as a mental health issue, you don't see it. So you look at any person on the street, who can you tell is depressed or not, or has these conditions? And I think that's part of the challenges that I can identify with is no one can see it. And then there's also an element of like, you don't know on that spectrum, which is this just me feeling an off day, or is this actually a persistent thing? And I'm just wondering if there's any helpful things that you've come to understand in terms of people listening in when they're saying, well, actually, is this just a baby blues? I don't know if it's just, I'm be careful how I use these terms, but when to start the conversation, and when do you think there's a point where you're like, actually, I really need to try and seek some further, more intentional help? Is there somewhere or some signs or indicators, either as the person going through it or as the carer looking after that person, that you would highlight in that?
Yeah, it can be hard to tell, but if you look at, I guess, the more common aspects of baby blues and depression, or baby blues, i.e., as I said, pre versus post, but this is obviously post. Baby blues will typically be a 1 to 2 week period after giving birth, very acute, but then dissipate and goes away. Postpartum depression and other, if we call them perinatal mental health conditions, that can occur, generally those that are persistent, more chronic, and so can occur anywhere up to, from pregnancy through to 12 months postpartum, typically. Okay. Sort of how it's classified. And if there's a chronic or a persistent condition or begins to get worse, and again, I'm not a qualified psychiatrist or mental health practitioner, but obviously familiar with the area. And so looking at persistent conditions, or are they getting worse rather quickly, looking to seek help in that case. Even when after everything happened with us, and I've been quite open about the story and whatnot, had people come to me afterwards and say, friends that had given birth some time ago come to me and say, I didn't quite feel right. I didn't quite know what was wrong, but I didn't feel myself. And this is after quite some time.
Yes.
But then heard about your story, then I went and sought help and was prescribed and feeling much better, and we were able to get back to normal. So there's many different ways that it can happen. As I said, it could be getting more acute more rapidly, or it could just be persistent, but kind of just the same sort of even level. If the wife or yourself, you're not feeling quite yourself for quite an extended period of time, and things aren't getting better, and feeling difficult, whether it's sort of anxiety or depression or another condition, then it's time to seek help. And I think being open with your partner, being able to be frank about, is everything okay?
Yes.
And being comfortable to reach out for help, but also for some husbands that don't know what's going on, not familiar with it. There's a nudge that as the mother, as the partner, you can say, maybe you should read this, or because obviously some people might not react too well to certain conditions. So it can be very difficult, but I think that breaking that stigma, and it helps by addressing it, I think, as early as possible and saying, these are some of the things that could go wrong. And then down the line, it's, oh, this is actually how I feel.
Yeah. I think that idea of, again, starting the conversation early, maybe during pregnancy, when you haven't got all the chaos of a new baby on your hands, and saying, this is how would we anticipate dealing with this if it were to happen, so that you've had that foresight as to what might happen. I think what's interesting about the potential of this happening postnatally compared to if it was a depression at another point in your life is for those that are going through it for the first time, or even the second time, let's say the first time, it is the first time you're experiencing childbirth, so you don't know what is normal. So let's say you've had let's talk about depression in another context, right? Let's say it was, you've had a breakdown of a marriage or something different, but you have a reference point that makes it, I guess, a little bit easier to show, this is how I used to be and this is how I am now. But I think that what's quite unique about the perinatal, postpartum, or postnatal depression is you don't know what normal is because you've got a new baby. And I think that's also an added challenge to identify what is par for the course. I remember speaking to...
Sleep deprived.
Exactly.
There's a lot going on.
And you would think, well, you would expect that to be the case. If I'm sleep deprived, I haven't, everything's a mess, we don't know what, you'd expect to feel a certain level of anxiety, and you might think that's normal. But it's identifying at what point does it tip into okay, this needs some support. I bring up an anecdote of a lady I spoke to where it was actually years later that she realized that she had PTSD. So she would get flashbacks when she lay down of the operating table, and she thought that was normal because she's such a high flyer, and so many of these superwomen out there are like, whatever comes up, I'll just deal with it because that's just what it is. That's just normal. But when you talk to anyone, you're like, that really doesn't sound normal. And it's only through the conversation with other people and having the courage or the strength to actually voice those things, thinking that it is okay. And actually, once you open up, you realize that everyone else has an element of that. That helps to triage that actually, okay, maybe this is less normal, and that you would may seek support. And as you said, even if it's years later, there is still a huge benefit and value, so that even if you have dealt with that immediate acute phase, there is such a great value to understanding what you went through and dealing with that.
And I've had people come to me after setting up the foundation, talking about our situation, that, like I said, I haven't spoken about this with anybody in 20 years.
Wow, really?
And that's mothers and fathers. So it's obviously a difficult period for fathers as well, seeing their wife in that situation, and it's difficult. And for them, as I said, like a couple of decades later, it's the first time, okay, it's the first time I've told anybody about this. And even for others with general mental health conditions, it's enabled others to open up to me about, I had depression. Some friends that have said, oh yeah, I had depression, and they're like typically very macho guys that don't talk about their feelings, but said, actually, I've been through this and had no idea. So it helps people open up and get things off their chests and sort of normalize the conversation.
I think that's the key thing, is it's a very powerful thing just to normalize the conversation. I come back to a conversation I had with around a guy called Matt Lowe, and he does something called the Dad Table, which is just a forum where dads can come to the conversation and have a discussion about anything and everything, and it's just normalizing what is going on. And that will look very different, maybe by generation, by culture, by life stage as well. But I think it's having those conversations and being aware of that. I also want to shine a light, I guess, on some of the work you've done recently to raise awareness. So, you've had features on, was it CNN, I believe, and you've been on, talk a bit about some of the things you've done at the PAM Foundation to raise awareness, both in Thailand and what that looks like. We'll also touch a bit upon, I guess, the cultural differences that you've witnessed and observed in the UK. You've also been in New York and US, and what that looks like. Yeah.
Couple of big things. Earlier on in the year, I did a run around Central Park, and the goal was to try and raise awareness and set a new record for a number of laps of Central Park in a day. So between open and closing hours. So I was able to do that, ran 19 laps, and each lap is about 10 Ks, 6.1 miles. 7 Ks or 116 miles in about 17 and a half hours.
Shit.
Yeah, so that was a long day, but it was good fun.
And just to put that context, so that's, I was that 4.5 marathons about that?
Something like that, yeah.
So 4.5 marathons.
Yeah. But I had a lot of support.
Good.
So part of my run club, the New York Athletic Club, and a couple of others helped support me. So I didn't run any lap alone. I had at least one person, often multiple people running. So that was good. And so we're now set up as a C3 registered organization in the US alongside the UK charity. And in the UK, when we first set up, I attempted a run across the UK. So that was back in 2022. So from John O'Groats to Land's End, the joggle. And after 4 days, I got injured and continued on bike for a bit, and then eventually was able to do bike and on foot, and then eventually finished just on foot for the last few days. So that was on average, it was about 70 kilometers or about 50 odd miles every day for 2.5 weeks.
Nice.
And then outside of that, just run a lot of marathons and ultras, and we had a spot in London Marathon this year. I mean, then we've got a few more in the upcoming years. So for me, running's been a big thing, just dealing with everything, processing everything, but it's also combined into the awareness and trying to sort of do some crazy runs to help.
Yeah, no, that's great. Congratulations on, it was a world record, right?
I mean, it's a record. I think the usage of the word world is a little bit generous considering it's localized to Central Park, but it is.
It was a record in the world. I want to touch on, so you've had global exposure to this area, both, from the East, the UK and America. What's been your observations or like learnings in terms of what are the differences? Are there differences? What are the major things that you might highlight in terms of how different cultures or regions or around the world deal with the topic of postnatal, postpartum depression?
So naturally, as you expect, there are some big differences. First of all, when we set up the foundation, well, for us, as everything happened, we sought help. And in the UK, US, we've been doing working with some people in Australia as well. There are perinatal mental health specialists. And so it's relatively easy to just Google something and there's a list of specialists to come up, and there's a network and whatnot. In Thailand, there's nothing, and it's very difficult to find who to go to, especially in our case, which was quite severe.
Yeah.
So first of all, that specialized training and focus, I mean, it's been in the UK for a little bit now. If you look at Maternal Mental Health Alliance, where you have various organizations that are members of the Alliance that help sort of set an agenda and push for perinatal mental health care in the UK, and then sort of similar organizations in the US and Australia. So for us, after everything happened, we wanted to look at best practices overseas and then take those to Thailand. And what we identified was sort of across that spectrum is that, as I mentioned, peer support networks, so those with lived experience, group support, which is a big thing in the US, been very successful either in person or online during COVID. And then that's sort of our first pillar. And then looking at care. So what do you do once you focus on the awareness and education? How do you treat? And looking at beyond the social support, identification and screening using the postnatal depression screening and other screening tools. And then looking at, can we provide training to psychologists, psychiatrists, raise awareness with pediatricians, OBGs, etc., everybody in the reproductive healthcare ecosystem. But in looking at those, you can't just copy and paste from the West out to Asia.
Yes.
So looking at the differences, first of all, in mental health is a much earlier stage conversation out there than it is here.
Okay.
So in terms of, it's changing as the generations come through, but I guess where the mental health conversation is in Thailand at the moment, in terms of how open people are and whatnot, it's probably maybe, I don't know, 10 to 20 years behind. But it is slowly changing. And in terms of adapting, as I said, like if we just use one example, like the group support, we've tried to push that out in Thailand, but we've had more interest in the one-on-one peer support. So speaking one-on-one with someone that's had lived experience, not so much the group support, which is a big thing in the US. And I think just culturally, there are differences around how people deal with these types of conditions. Maybe that will change, but right now that's just an example.
Yeah.
And then obviously, as we look at providing that training, whilst we've sponsored training from UK perinatal specialists, we don't have a huge amount of like Thai case studies or Thai context. And so trying to develop that understanding and through setting up an expert network out in Thailand and allowing mental health professionals to share their stories and support one another in that way. So culturally, some big differences around stigma, taboo, etc. And then naturally, there's in how do we fix that? We can't just copy and paste the best practices from overseas. So having to adapt those into a Thai context.
Yeah, those are some helpful insights because as someone with an Asian background, I know that when we went through pregnancy and birth, or even anything outside of that, but just general life events, we tend to keep things a bit close to our chests, and we kind of guard our privacy. I talk personally, I don't know if I speak for everyone else. And there's also an element of fortunate that we tend to have, fortunate sounds unfortunate, we have a lot of family support as well. And what you might seek from a friend or outwards, you often get from a family perspective. Now that has, I think, a positive and sometimes a negative perspective, where I think the positive is great. Obviously, you've got that familial support, but the trade-off is that sometimes comes with a lot of expectations of how things should be done, right? I did it this way, you should do it the way I'm telling you. And obviously there's that sense of deference, I think, to your elders, which is, if that's how mum and dad did it, that's how I should be doing it. And that every Asian, I think, or certainly I can identify with the desire to not disappoint. And any sign of, like, again, I spoke to another mother where, unbeknownst to her, her mother had postnatal depression with her 4 kids, but had never said anything. She subsequently had depression when she had her baby, found it very difficult to talk about, but only later found out. And she's like, wouldn't it have been helpful to talk about? But that's oftentimes, I can identify, again, as someone with an Asian background, that is something that is not always talked about. And how you deal with some of those challenges, we don't do that in a group setting. Again, you don't want the idea of like airing your dirty laundry. It's kind of like a bit of a taboo thing. But I think what's important is comes like reframing that conversation, where this isn't a dirty conversation. This isn't you just sharing your gossip with the world. This is actually a very healthy thing to do. And I think learning how to do that, especially in this day and age, I think is a very important thing that I think is changing, because we have so much more exposure to other things out there, and to see the benefits of talking about these things. It's the same thing with like things like money as well. People don't necessarily have to talk about it, or there's a taboo or a negative association with how you talk about it, or the topic rather. And it's not necessarily the topic itself, but just how you talk about it. So whether it's to do with depression, to do with mental health, the topic itself is agnostic. It's just how you talk about it, and the right way to talk about it, or a healthy way to talk about it. So I think what's interesting from your insights is, yes, there will be cultural differences, but it's finding your way to talk about it, as opposed to just saying that topic is off limits, which I think is, we all know what happens when you sweep something under the rug is, that it just builds up and erupts somewhere else. So I think the important thing, which is, however you identify with the culture or the ways that you do things, is just to have the conversation in your own way. And there's probably an element of, maybe the first time you do have it is uncomfortable because you haven't found your way as yet. So whether it is in a one-to-one or a group setting, maybe you need to try both of those to figure out what works for you.
Yeah, I guess coming to your point about the sort of, firstly about the Asian culture and keeping things within house and the familial relations, obviously culturally very different to the West. It depends family to family. Naturally, that's a big difference. There are, I think, when it comes to that East versus West, I think that the typical support, I will say just maybe from a slightly different observation, the typical support network and the household structure is changing, is becoming a lot more nuclear than used to be out in Asia. So not necessarily something that I can personally talk to too much, but looking at statistics and how typically it might be under one roof, the young professionals, they're living in their own sort of separate dwellings and not split from family structure, but that is becoming more Western, I guess. But yes, there's naturally still that aspects of deference and being concerned about living up to expectations, but living up to expectations that can get just as much pressure in the West as well.
Yeah.
Yeah. And then looking at even, I guess, one other aspect I didn't mention, even looking at the Thai side, even the lexicon of depression and mental health is limited. So it's like
that's interesting.
They're trying to figure out, okay, the word that's kind of used for depression at the moment is sad, effectively, but it's not. It's not just being sad. It's how do we, aside from, do we just use the English term depression? Is that sufficient? What are the different words that we use in perinatal mental health? If you were to literally translate it, it's not going to work out. So you need to figure out even how to describe it. So
that's really interesting.
Some differences in that as well. So very fundamental aspects that need addressing.
That never even occurred to me, actually. Yeah, just the vocabulary to describe what you're going through. And it kind of mirrors a little bit of, on a related note, we were speaking previously to someone where they didn't know what they were going through, and they weren't even sure how to voice it. They didn't even know the words to describe what they were going through, because, you know, there's the brain fog, or even something so unique for the first time, they didn't even have to describe it. So this was in the context of self-advocacy. So how does she stand up for herself and to advocate in that area? But she didn't even know the words to use in that element. So I think that's a really important point to figure out, and having a trusted someone to help, or someone with a lived experience that can give words to what you're going through, I think is really important. And just to structure your thinking, I think is a really important thing. Let's switch the conversation now. We've talked about awareness and education as a big thing. We talked about the barriers and some of the challenges of that. Let's talk about care now, and that second pillar. Now, you've talked about the spectrum of care and finding the appropriate care that you have. So again, is it something, you know, at what point does it tip into a clinical intervention? Or where might there be, if you identify early enough, where might there be some other measures that can be taken in place? So can you talk to me a bit about that broad spectrum of care? Where do we start with that conversation?
I guess the first bit is trying to identify what is going on. So in the past, it might have been referred to as screening. Some people now call it identification. There are plenty of, aside from the EPDS that I mentioned, there are other questionnaires and lots of, lots of online resources now that are cropping up that look at, I guess, is reluctant to use the word, but some of the AI solutions that do look at, ask questions and say, okay, identify how you're feeling and where there might be more concern. So I guess you could start by just Googling postpartum depression questionnaire and then sort of doing it that way yourself. But naturally, just be aware that, okay, if you do come back with, you might have some issues, then be prepared to seek help and being comfortable seeking help. And I think that in the UK, going to the Maternal Mental Health Alliance or any of the other organization websites here is a good start, and there's plenty of resources there. We provide some resources on PAM Foundation, but I think that there are plenty of resources out there already in the UK, so I would recommend those ones. For people in Thailand, we have some resources there, and we'll be updating that shortly with those that we've provided sponsorship sort of sponsored training for. And so as we build out that network, that I'll come to that. So that identification, screening, talking about how you're feeling, answering some questionnaires, and then looking for the appropriate resources. And as I said, that could be a peer support, group support, that social support. But then if you don't find comfort from that, or you don't feel comfortable, then naturally speaking to a psychologist in the first instance, and then maybe going and speaking to a psychiatrist if need be. And even some people might not be familiar with the difference between psychologists and psychiatrists. So, so that's something to be aware of and understand in terms of psychology and talking through the conditions versus actually being prescribed medication from a psychiatrist. So it can be a steep learning curve of understanding the differences of, as I said, postpartum versus postnatal, but there's no difference. Psychologist, psychiatrist, what is the difference? What does it mean to go and speak to either? And then coming back to the differences between East and West, in Thailand, typically for any mental health conditions, you have to go to a psychiatrist first.
Okay.
So before you can even go and speak to someone, a psychologist, about your condition, then you have to go to a psychiatrist.
Right.
For them to assess you and then to get a referral. I'd almost say it's technically not right, but a step backwards in terms of, I think if you look along the spectrum of that peer support, psychology, and whether you're doing cognitive behavioral therapy or some other recognized practice, and then getting prescribed medicine, it goes straight to one end of the spectrum and then you sort of work back. So that can be quite an extreme and confronting if it's like, is something wrong with me and I need to take drugs to get fixed. It's like, okay, well, let's just figure out what's going on and try to go step by step. So even culturally, there's a difference. And different medical systems and what you can claim, what you can't claim and whatnot. And so it's a bit of a minefield when it comes to understanding what to do in your country compared to if the advice is coming from another country.
And we can put some links to some of those helpful resources that you've mentioned, both in the UK, US, or Thailand, so that people listening to this can just click on those and find further information. And I think you're right, which is the job of associations like ours is just to signpost to existing good information and to highlight those as opposed to trying to create your own, because there's a ton of great resources. And I think it's more about the curation of those and signposting that people need to be aware of, as opposed to us feeling the need to do our own one. What would you say to someone? So oftentimes, the experience of depression is experienced obviously by the person going through it, but also people around them, like the carers, maybe it's the partners, the mothers or fathers, etc. There are, we've heard anecdotes where actually it was the person caring for them that identified the fact that they're actually, because they had that outside perspective, because you as a person may not, appreciate how you're feeling, but someone that's dear to you can point out or be there to identify, like, hey, you're not how I used to. What would you say to someone that is caring, that is close to someone going through this, how they can be supported, or what they need to know at this point? What does care look like for them and for what they can do for for the person they love? Speaking
personally, it was a very big change. So it was quite easy to recognize something wasn't right. But then from that point, what do you do? And it's trying to find the right help, trying to find the right support, being open. We had a lot of great support within the family. So that was great. But regardless, it's understanding, I think, what can you do? Being patient. Again, depends on the situation. So what's required will differ, but it is being attuned to wants and needs and trying to get through. It can be extraordinarily difficult. I'm not going into detail, but it can be extraordinarily difficult for multiple reasons. But I think there's plenty of resources online. But I think it would be good to be part of that process as needed, in terms of supporting your partner seeking help, and then asking those professionals what you should be doing as partner to help them. But again, it's horses for courses as to what's needed, but it is having that sensitivity and that people know their partners best. So just being open, being there through that difficult time.
And I imagine an element of knowing what you need to be careful, like caring for the carers, is a big thing as well. And I imagine not feeling too guilty or to say, I need some help too, right? Because you can only give what you've got. And if you're running on empty, you guys, what is it that the carer needs? And leveraging their network or their resources to get what they need to in order to care for the person.
If that's tag teaming with the family or whatever it might be. Then,
exactly.
Then,
Exactly. And so hopefully there's some helpful points. I don't know if there's any other resources or affiliations you would highlight in this conversation that you come across. If not, we can always refer back to what you've talked about, I don't know.
So I mentioned Maternal Mental Health Alliance in the UK.
Yeah.
In the US, Postpartum Support International, the PSI have been great support for us as well. Providing some resources, doing some interviews and whatnot, and they've provide a lot of group support and contacts online. And then in Thailand, I guess we're a good starting point. We have provided sponsored training for a handful of psychiatrists now, and there's a new clinic set up by UKA, a private company startup that's focused on mental health, and some of their practitioners have received our training, and then some others at Surirat Hospital.
That's great.
So it's slowly trying to train up those in the network. Yeah, so
that's great.
Those three countries. Yeah,
no, that's really good. I know there's a ton you guys are doing, and as I mentioned, we'll link in the description to some of those resources that people can find them. So let's move on now to, I guess, the last pillar, which you're heavily involved with, and I know you've got a partnership with Oxford Research. That's right, and the work you're doing there, and talk about what are some of the insights, revelations, surprises that you found in the research to better understand what's happening, and what are the elements that make up, you talked about the biological, the hormonal, the biochemical. What are some of the things you're learning more about this from the research that you're doing?
So on a personal note, the research and understanding is a big aspect that I wanted to address after everything happened, going through what we went through. And it was a role of the diocese to what SRIs, antidepressants, would be used, and this doesn't work, increase the dosage, that doesn't work, change it, do this, do that, and nothing was effective. And from my background, my normal professional background, investing in early stage biotech startups, and sort of understanding that process. For me, I wanted to see if there's something that we could do in that space. I mean, looking at research into mental health in general is pretty low. Research into women's health is very low. Combining those two, research into women's mental health is basically nothing.
Yeah.
And so I looked for, what research can we support in this space to better understand what is going on? Okay, yes, we know that there are, as you mentioned, hormonal changes and fluctuations, but that doesn't explain everything. It's like, what causes a headache? It could be a multitude of reasons. And so I want to understand, is there something that we can do more effectively to address this? And before we can do that, it's not just taking sort of standard antidepressants and applying them, which do work in some cases, but not all. So what is actually going on? What are some of the potential causes, and better understanding that? There have been some more since everything happened. For us, there have been more novel drugs that have come out, synthetic hormones, some research into psychedelics as well.
Okay.
But the research that we're supporting at Oxford is specifically looking at epigenetics and how that might get disrupted around the birthing period. And basically what that means is that epigenetics is the way that the body expresses genes. So your genes might be telling your body to do one thing, but then how that actually occurs might get disrupted, and the body might not be doing what it should be doing, basically.
Okay.
And so if it's like your body's trying to read the genes as a book, but it's not reading it properly, or it's got the book upside down, it's not doing what it should be doing. And so we hope to have some results announced soon. There's some interesting results from the start. It's a 3-year study. We're about 2 years through that now.
Okay.
And so that is a very novel way of looking at postpartum depression, or also potential aspects to postpartum psychosis, which we haven't touched on, but it's another condition. And so, yeah, hopefully if we can identify exactly what's going on, we can further that research to figure out, okay, how do we fix it, rather than the sort of roll of the dice that we have at the moment. As with a lot of what might be referred to as medicine 2.0, where we're treating the symptoms and not the cause. So hopefully we can identify the cause.
Awesome.
So that's very early, well, I say 2 years, still at very early stages in terms of, okay, what can we do? Assuming we have good results, then what can we do from there? So it's going to take time. But I guess in setting up PAM Foundation, that is a big aspect of what we wanted to address. So as I mentioned, the awareness and education, care, there's a lot in the West that's being done in that space, but not so much in the research side. The way that the foundation is set up, we're doing a lot of advocacy, awareness, education out in Thailand to start with, and then in the West, the focus is more research side on the medical aspect.
So there's a ton there that you guys are doing. And again, for anyone interested, we will share the links to the PAM Foundation and the work that you're doing. I think it's some fantastic work. So I'll close out, Hamish, with a question of what gives you hope in the future? What are you seeing that you've come across that gives you hope for the future in terms of what you're discovering and what's the work that you guys are doing? So
hopefully our research will help us better understand, but beyond what we're doing as a foundation, there's a lot more people such as yourself interested in this space. And it is going to be a very difficult period for new mums and families. And so the fact that more resources are being invested in this space gives me hope that we can address not just the awareness and education, but also even here in the UK, there's still, and in the US, under-resourced in terms of the care that can be provided. There are good psychiatrists, psychologists here in the mother-baby units where you can be checked in as an inpatient with your baby, which don't exist in most other countries, but even there's still a lot of underinvestment and under-resourced areas of perinatal mental health conditions, care. So looking at more resources, and as I mentioned, I'm reluctant to mention AI, but there are some good AI solutions out there now that sort of help augment that spectrum of care. So it's not these aspects of care are not mutually exclusive, but sit on a spectrum, sit on a suite of offerings. And so hopefully we can sort of fill that out. And so we have a range of treatments and care that can be customized, and you can pick and choose what works for you. And it's like any mental health, any physical condition, and it's not one size fits all. So it's filling out the bows in the quiver to figure out, okay, well, what can we use?
Good. So there's a lot to do, but there are things being done. And again, people like yourself are pushing the space. So again, Hamish, thank you very much for coming on.
You're welcome.
It's been really great to have the conversation. For those listening in, I think if you think you want to highlight about what you're doing, the work that you do also in Break Off, like anything you want to highlight before we wrap things up?
I guess there's a lot going on. Always looking for those willing to support us. We've got a multitude of charity spots coming up for the runs, and so anybody that wants to run for us and help raise awareness and
not necessarily ultra runs, right? Not like doing 4.5 marathons in a day, right?
It doesn't have to be that.
Okay.
Yeah, can be park run, 5K, whatever it might be.
Let's start there.
Yeah, happy to support as needed, and help those that are setting their own goals as well for those runs and challenges to help them get through it.
Awesome.